Prostate cancer is one of the most common types of cancer in men. Here in the UK, more than 52,000 men are diagnosed with prostate cancer every year. That's 144 men every day. My name's Dr. O'Donovan, and in this video we're going to cover what prostate cancer is, potential signs and symptoms, and finally when you should go and see your own doctor. Now, this video may save yours or a loved one's life, so please do watch it to the end and do share it with someone who you think could benefit from it. So first of all, what is prostate cancer? Well, the prostate is a small gland in the pelvis and it's part of the male reproductive system. It's about the size of a walnut and it's located between the penis and the bladder, and it surrounds the urethra, which is the tube that lets urine leave your bladder. Now, this is really important because some of the symptoms of prostate cancer that we're going to discuss later in this video involve problems when you go to the toilet to pee. Now, the main function of the prostate is to produce a thick white fluid that creates semen when mixed with sperm, which is produced by the testicles. Now, the prostate can develop cancer. This is when abnormal cells start to divide and grow in an uncontrolled way. The cells can grow into surrounding tissues or organs, and they can also spread to other areas of the body. So now you know what the prostate is, as well as what it does, let's cover some potential signs and symptoms of cancer. Now, the first important thing to mention is that prostate cancer may not produce any symptoms for many years. That's because, generally speaking, prostate cancer tends to develop slowly. Now, most prostate cancers start in the outer part of the prostate gland. This means that in order to cause symptoms, the cancer needs to be big enough to press on the urethra, which is the tube carrying urine from the bladder. Now, early stage prostate cancer rarely causes any symptoms, but the following signs and symptoms may occur as the disease progresses. These are the frequent and sometimes urgent need to pee, especially at night, which is known as nocturia, weak urine flow or flow that starts and stops, pain or burning when you pee, loss of bladder control, known as urinary incontinence, painful ejaculations as well as erectile dysfunction, blood in the semen or blood in your pee. Now, if prostate cancer has spread from the prostate, then potential symptoms can include pain in your lower back, hip or chest that doesn't go away with rest, as well as unexplained weight loss. Now, a common question often asked by people is, are problems with peeing always a sign of prostate cancer? Now, it's really important to note that other conditions that are not cancer can cause symptoms similar to prostate cancer. These include benign prostatic hyperplasia, known as BPH, which is a non-cancerous condition which enlarges your prostate gland but does not increase your cancer risk. And at some point, nearly all men will develop this. The other condition that can mimic some of the symptoms is prostatitis, especially in men under the age of 50. Prostatitis is another non-cancerous condition that causes inflammation and swelling in your prostate gland, and typically it's caused by bacterial infections. Nonetheless, if you're experiencing changes in how you pee or any of the other symptoms that I've mentioned, it's important to go see your doctor so that they can properly assess you and carry out investigations if needed. That's because if it is a cancer, picking it up early could lead to much better outcomes. And please don't be embarrassed or worried about going to see your doctor. This is a problem that they will have managed before, and it's something that's really important to speak to them about. So what's going to happen when you go and see your doctor? Well, your doctor will likely ask you some specific questions about your symptoms, such as what they are, how long they've been going on for, and if they've become more frequent or if they've got worse. They'll also need to examine your prostate, which they'll do by placing a gloved finger with some lubricating jelly into your bottom. By doing this, they'll be able to feel the prostate and check how big it is, as well as its consistency, so whether it's smooth, hard, or lumpy. They may also carry out a blood test called a PSA test, and I've included more information about this in the description box of this video. Finally, who's at risk of developing prostate cancer? Well, prostate cancer is most common in older men. On average, each year, 35 out of 100, so 35% of new cases are in men aged 75 and over. It's also more common in black men than white men. Now, the risk may also increase if you've had a direct family member with prostate cancer, breast cancer, or ovarian cancer if there's a genetic component involved. Now, I've included lots more information on prostate cancer in the description box of this video from trusted sources like the NHS, Prostate Cancer UK, as well as Cancer Research UK. So please do look at these if you want to learn more or want to have some useful resources before you go see your own doctor. Please do leave a comment below if you'd like to share your own experiences or if you found this video helpful. I'd love to hear from you. Thanks again for watching, and until next time, bye.